Hello, my name is Dr. Emily Blumberg. I'm the Director of Transplant Infectious Diseases here at the University of Pennsylvania. I'm joined today by my colleague, Dr. Kathleen Murphy, the Associate Hospital Epidemiologist here at HUP, and also a Transplant Infectious Diseases Specialist. We're here today to talk to you about an update on COVID-19 with a focus on the COVID vaccines. I think it would be helpful if we start just by reviewing where we are today, the end of June while we're taping, with COVID-19. So Kathleen, maybe you could bring us up to date.
Sure. So this graph here, you can sort of see the general curve that we've seen throughout the course of the pandemic in the United States with average daily number of cases. And you can say we really reached our peak in the United States around January and February of this year. And luckily since then, while we've increased our number of vaccinations in the country, we've seen a gradual decline. And right now we're seeing the lowest number of cases we've reported since the beginning of the pandemic, almost as low as 10,000 cases per day. So we're in a much better place and we're optimistic about where we are in the pandemic right now. And how well are we doing with vaccination? Let's take a look at that. So currently in the United States, there's over 150 million people who are fully vaccinated, which is really an amazing percentage. You can see on the right side, that's about 54% of the population who've received at least one dose of the vaccine and about 46% who are fully vaccinated. And this is including the fact that we don't yet have a vaccine approved for children less than 12, who make up some proportion of the population. But that really is an impressive number, although we would still like to see it higher. And we're doing work to make sure that anyone who wants a vaccine can get a vaccine and that we improve these numbers even further to keep everyone safe. And you can see in this graph from the New York Times that there's areas of the country that have higher percentages of people who've received at least one shot of the vaccine than other areas. And interestingly, the areas where there's higher vaccination rates are seeing much lower numbers of COVID compared to the states and even counties that have lower vaccination rates. So it's just a reminder that we, our communities, our families, our friends, really have the tool of vaccination now available to us to keep numbers low and keep ourselves and our loved ones safe. And in this next chart, you can see that this is, again, data from the New York Times and the CDC that shows that the highest number of cases per 100,000 people in the areas where we live are in the lowest percentage of people who are vaccinated. So right now in June, there were about almost 5 to 6 cases per 100,000 people in areas that had the lowest vaccination rates, lower than 30%. And in areas that had more than 60% of people vaccinated down at the bottom, the cases were much lower, as low as 2 per 100,000 residents. So vaccination is how we've gotten to this good place we are and how we will stay in this place where there's very low community spread and low transmission and keep ourselves safe.
Thanks, Kathleen. You know, there are so many vaccines that you hear about in the news. I wonder if you could share with us which vaccines are currently available in the United States and what we're using here.
Good question. So right now in the United States, there are 3 vaccines that have been authorized and recommended in the US by the FDA to prevent COVID-19. All of them work very well. They're all safe and they're very effective about preventing COVID-19 and severe illness. So the names you'll have heard in the media are Pfizer and Moderna, which are the mRNA type of vaccines. These are 2-shot series, so you get the second shot a few weeks after your first dose. And the Pfizer vaccine is actually now approved even for children over age 12. The Johnson & Johnson vaccine is the 3rd type of vaccine. This uses a different type of viral vector, an adenovirus vector, to also give you a similar type of immunity, and it's only 1 shot. That's approved for people over 18. So all 3 of these vaccines are approved. They're all safe and effective, and they're all available to you locally.
Now, there's so many things you hear about in the news about these vaccines, and I think the public is really concerned to know if the vaccines are safe. We here at Penn have been hearing about these vaccines and these vaccine platforms for over a decade, as one of our colleagues actually was instrumental in the development of the vaccines. So we know it took a long time to actually develop this And while the rollout seemed quick, it was only because all the preparatory work had been done over so many years. But how can we reassure people to know that these vaccines are safe?
Well, I think the things that I like to think about and that I share with my patients and family and friends are a couple of things. First of all, the safety data for the tens of thousands of people who were in the trials that led to the approval of these vaccines in the US was carefully reviewed by many experts by the FDA before they were approved, with a very rigorous process to make sure that all of the data in these trials was reviewed and that they were safe and effective. The second thing is that right now, as we mentioned, we have over 100 million people in the United States who've received either one or two doses of these vaccines. And they've been very closely monitored to make sure that we aren't seeing any side effects that we hadn't anticipated and that they remain safe. And out of this careful monitoring, we've seen that serious side effects, which you may have heard about in the news, these include things like an allergic reaction to the shot or a blood clot, or more recently, there's been some data in younger men about inflammation of the heart muscle, that these are extremely, extremely rare side effects and are so much more rare than the risk of getting COVID and getting seriously ill from COVID, that we feel like the benefits of that vaccine so far outweigh any risks, and that these risks are so vanishingly small that these are very safe vaccines, and we continue to recommend them wholeheartedly to our patients, friends, family, and communities.
I think it's important to remember that people are constantly following these vaccines for safety. And what you may not be aware about is there's actually 4 different systems that the CDC has put into place to monitor safety. The first one is something called VAERS, the Vaccine Adverse Event Reporting System, and that's been around for a very long time. And basically, that's a system where anybody who thinks that there's been a serious adverse event, something bad has happened to somebody receiving a vaccine, can just go on this system and report the event, and it will be investigated. And they actually go through and monitor these events to determine if there's multiple reports, so lots of different people reporting the same event, and then that would make them really start to investigate. But the CDC has put 3 other systems in place as well. There's something called VSafe, which was an opportunity for people receiving these vaccines to be part of a text monitoring system where the CDC would text you at different points after you'd gotten your vaccine to see how you were doing and if you were having any problems. And they did this with thousands and thousands and thousands of healthcare workers, all of us getting these texts and responding to see if there had been any risk from the vaccine. But there are 2 other systems that they've put in place as well to try to capture these sorts of bad things happening, like the ones that Kathleen was just mentioning. One of these is the Vaccine Safety Data Link, where they actually have linked to very large insurance-based systems to actually see if there's been increased reports of things like blood clots or other serious events in people who've received vaccines, and they actually are capturing that data to really try to get at these very, serious reports that people are worried about, but to date have not found any really concerning evidence for. The final thing is they actually linked to a group of health systems that have very strong vaccine networks for actually doing studies of vaccination safety. And this is the Clinical Immunization Safety Assessment Project. And this was put in place specifically to look at pregnancy outcomes and issues related to pregnancies in people getting vaccinated. And this is why we feel so reassured that this vaccine has been shown to be safe in pregnant and nursing mothers and has not affected fertility. So it's just really nice to know that people are paying such close attention, and we still have a lot of evidence that the vaccines really are safe. But I think there's still a lot of information circulating about things that this vaccine can do. So Kathleen, maybe you can share with us some of these common vaccine myths.
Thanks, Emily. So these are a lot of questions I get from my patients and community members. And I think, as Emily said, there is a lot of information circulating that may not be completely accurate and can sound very alarming when you're thinking about getting the vaccine or encouraging your friends and family to get vaccinated. So just a couple of reminders. The COVID-19 vaccine it doesn't contain live virus. None of the three vaccines do. So you can't get sick from the vaccine, meaning you can't get COVID from the vaccine, and it won't cause you to test positive, for example, if you get tested for COVID after you get the vaccine. So that's one important thing to realize. As Emily already mentioned, there were a lot of concerns by some people about, will the vaccine affect my fertility? And in all of our data safety monitoring, we have not seen any indication that this vaccine affects fertility, which is good. The COVID-19 vaccines, although they contain components of genetic material very similar to our own genetic material, and that's partly how they allow our bodies to make the immune response to the virus, they don't alter our DNA, meaning our genetic material. They don't insert in our DNA. They don't affect our genetic makeup. So that's important to understand too. And finally, there's been some recent concern about the COVID-19 vaccine affecting your menstrual cycle or those around you if you get vaccinated. And in all of our review of the evidence and data, that does not appear to be the case. So I think that's another myth that's circulating in the community and may be helpful for you to understand. So Emily, one question I get from my patients that I think is sometimes important to explain is, how exactly do we know if a vaccine is working?
This is a great question, and I think this really is something that's the most important part of all, is to know if we're getting vaccinated, what it actually does for us. And so basically, vaccines can be effective at both preventing infection, so you may be exposed to the virus and you never get infected in the first place, or preventing disease, which means that maybe you get infected, but you have no symptoms. But especially important with COVID-19 is preventing the more serious infections, those things that make you need to go to the hospital or wind up in an intensive care unit or even die. And the final piece of this is preventing transmission. And what's been especially impressive with all of the COVID-19 vaccines available in the United States is how well they do at preventing severe disease, hospital admission, and death. And what we're starting to learn more and more is that they really do make a difference preventing transmission, and in many cases preventing infection completely. And in fact, when we look at the information that we have on these vaccines, we find that there are only a very small number of people who've been vaccinated who actually go on to have symptomatic infection. And this is so much better than almost every other vaccine that's out there in terms of being really effective in the real world. So one of the things that people are really focused on is using blood tests to tell if the vaccine is working. And while these blood tests can be available, I think it's important to look a little more closely at them to see what we really learn. So when you develop an infection, or if you've had a vaccination, your body can make a response to that, which can be partly measured in some circumstances. The easiest thing to measure is something called antibodies, and that's something that can be measured in a simple blood sample. But with COVID-19, the antibody test is a little complicated because it turns out that the vaccines specifically have one particular part of the COVID virus, something called the spike protein. And so if you're going to look at antibodies, you need to make sure that the antibody test is specifically one that measures the body's reaction to this spike protein. And it's important to realize that the general antibody test that's out there is not necessarily measuring the reaction to that one particular protein. So if we're trying to understand if the vaccine is working and we want to do an antibody test, we need to look specifically at that one reaction to the spike protein. But antibody tests have a lot of limitations, and before I think we all go out and feel that we need to get them, I think we have to realize a couple of things. The first is that the antibody test levels don't really have any connection to what we know to be protection. In other words, different tests are available. They have different measurements that they use to give them a result, but the actual number you get from the different tests may not actually be related to what is actually a protective level. So we don't really know how much antibody you need to be protected. And I think that's very important to realize. We also know there are a lot of different tests out there, and they have different reliability. And so you need to make sure if you're getting a test that you're getting a test that actually performs well in the laboratory setting and performs in a way that the numbers actually mean something. We also know that the antibody levels themselves may not directly relate to how much you need to be protected. And so since we don't have those absolute numbers, and because there's so much variability in the test, the FDA has actually recommended that people do not get antibody testing after vaccination to determine whether or not they've made a response to vaccine. So how do we know if the vaccine works for transplant patients? Well, there's another piece of this that we need to know. When your body is responding to a vaccine, it's not all about antibody. There are different parts of your immune system that actually help you prevent infection and getting sick from COVID-19. One of these components is something called the cellular component. It's actually a response that your body makes that can be very important, but is not easily measured by standard blood tests. We know that patients may get a response in their cellular system that is not measured by antibody, and that the antibodies may be positive in patients who don't have a cellular response. We suspect that you don't necessarily need both to work to have some protection from COVID-19. So it makes it complicated if all we want to do is rely on this blood test. So instead, we have to rely on what we call real-world experience. And what we're seeing throughout the United States and throughout the world is that overall transplant patients who are getting vaccinated are having fewer hospital admissions and fewer severe disease experiences. In other words, the number of patients who wind up going to the ICU, the number of patients who wind up dying is dramatically less after vaccination than it is in people who have not been vaccinated. And while we're still learning how well the vaccine works, I think we all feel confident that being vaccinated for the majority of transplant patients is going to help protect you against COVID-19. Now, that doesn't mean it's perfect, but unfortunately, when people get immune suppression, nothing is perfect in terms of protection. And so we do think, though, that it will be very helpful to get vaccinated to prevent you from getting COVID-19, to prevent you from getting really sick from COVID-19, and to protect you from dying from COVID-19. So we've heard a lot about variants, and I think it would be really helpful, Kathleen, if you could share with us what actually we're talking about when we're talking about variants, and then maybe what the whole point of vaccination is in this setting.
So very good question. And we do get a lot of questions and people concerned, and you'll probably hear in the media, in the news, a lot about variants recently. So let's start with, what is a variant? So one thing to understand is that it is very normal for viruses to change through mutations as they exist in the community. This is constantly happening, for example, even in viruses like the flu. And it's just a natural process that happens to virus as they have these mutations, and they change as it's spread in the community from month to month. And some of these changes are not significant, but some changes in the virus can make the virus more contagious or can make people sicker. And that's kind of when we get alarmed, when we see changes in the virus that can either, say, spread more easily in the community or can make people more ill. So we've been monitoring very closely through both local labs and the CDC what types of variants are circulating in communities in the United States and actually globally. because many of these variants develop in other countries that have, for example, not had as successful vaccination as the US and have a lot of virus circulating, which is sort of the perfect setup for some of these changes in the virus to develop. So you may have heard throughout the course of pandemic, new variants happening across the world. For example, in Brazil, in the UK, there's also been variants that have come out of places in the US, like New York and Los Angeles, when we've had higher numbers of circulating. So this is something we're watching very closely to understand what is being transmitted in the community. And we're also watching very closely anytime we identify a new variant to make sure that our current vaccines are effective and still protect against this changing virus. And on the right hand of the slide here, I just wanted to show you that many of you have heard in the news about the new Delta variant, which is pretty much the latest variant of concern that's circulating in the world and increasingly so in the United States. And I have a red box here on the right around what's listed as B1617.2. That's the formal name, but we call this the Delta variant. So you can see in June, the numbers were starting to increase in terms of the percentage of the virus in the country that's this Delta variant, which is more transmissible and sort of our latest variant of concern. The light yellow, the one that says B117, is the UK variant, which was previously and still currently the dominant variant in the United States. But we suspect that this Delta variant will sort of be the next most common virus that's transmitted because of the patterns that we've seen around the world.
So Kathleen, how are the vaccines doing against the variants? Are they effective?
We're learning real time how well the vaccines are protecting us against variants as they develop. And the good news is that so far, all 3 of the vaccines approved in the United States have been very effective against the circulating COVID-19 variants. And we're watching very closely to see how these vaccines hold up to the newest variant, the Delta variant, as we discussed. So far, we have data that for patients who are vaccinated with both doses of the Pfizer and Moderna vaccine, they should be very well protected, and that the AstraZeneca vaccine, which is a similar type of vaccine to the Johnson & Johnson vaccine, is also very effective against this variant. We need more data about the Johnson & Johnson vaccine, so more to come, but we suspect it will also be very effective, and this is all good news. So Emily, another question we get a lot relative to the variant and from transplant patients who are wondering if they should get a 3rd shot is, do we need a booster?
I think that's a great question. There's been a lot of news recently about giving transplant patients and some other patients as well booster vaccines. And when the vaccine first came out, we were hearing a lot about whether everybody might need a booster, perhaps in the fall or annually. And we still don't know whether everybody will need a booster, and if so, how often that will occur. But because some transplant patients don't respond as well to the COVID vaccine as people who've never seen immune suppression, I think there's been a particular interest in thinking about booster vaccines and whether or not that might be a way to improve the response to the COVID vaccine for transplant patients. And I'd like to start by saying first that in the United States, the current authorization for COVID-19 vaccines does not specify giving booster vaccines. So it is actually not part of the current approval to give booster vaccines in the United States, which means that really booster vaccines should be administered only as part of research. And I think that's very important to know. Some of the research that is being presented now in the media has actually come from overseas where there are different restrictions on vaccination and different protocols. So that's the first thing. The second thing is that we're still learning a lot about the response of your immune system to vaccination, even with the standard vaccines. And as we learn more, we're starting to learn more about what sorts of things affect your ability to respond to the vaccine in the first place. And this is going to be very important to help us understand how best to improve responses, even in the absence of a booster vaccine. The data that's been available, and this is in very, very small numbers of patients, suggests that for some people, but not for everyone, booster vaccines may improve the development of that antibody response. So far, we don't know much about the cellular responses, that other part of the immune system, both in terms of booster vaccines and even in terms of a lot of the patients and what affects their responses to begin with. So I think we're a little early to be talking about booster vaccines, especially when we think about the numbers of patients we'll need to examine this in to understand both how effective they can be, what could be done to make them more effective, and also how safe these boosters can be. So at this point, we are not advising a booster vaccine. As with everything else with COVID, this could change, and we'll be sure to keep you updated as the situation evolves. But for now, no booster vaccine is recommended, but we are eagerly looking forward to learning more in the near future. So we've talked a lot about vaccines, and I think the first and foremost thing we would all agree on is to stay safe. Everybody should be vaccinated. But Kathleen, maybe you could go through sort of the do's and don'ts and what people can do to help stay safe now.
Yes, and I think this is really important. So as our communities are opening, as numbers are decreasing in the United States, I share that we want all of you to be able to live your lives a little more and to be able to kind of navigate the safer environment that we're in. But we really do want you to stay safe. So in addition to what Emily said about making sure you get vaccinated, make sure your friends and family are vaccinated, because that is some of the best way to keep yourself protected. The people you're going to be spending the most time with, that they are also protected. And if, for example, that may be a really good way to protect you if as we talked about, the majority of people will have a benefit from the vaccine, but the people around you may not be on immune suppressive medications, and that can really be a really good buffer for you to help keep you safe. I would say we always prefer and recommend, if you're going to be in a social setting, to try to have outdoor activities rather than indoor activities, and especially to try to stay outdoors and spaced away from people if you're not sure that everyone is vaccinated. We still recommend that you wear a mask when you're indoors in public spaces such as a grocery store, public transportation, an office, a school setting, or particularly if you're indoors in a setting where not everyone is vaccinated. I think especially as we learn more about what's going to happen with some of these variants, and especially if you're in a community where vaccination rates are lower and you are seeing still some transmission of cases, that's really important. And I would also recommend you follow local public health guidelines, because they're going to be watching on a more local level what's going on with cases in your area. This also just a reminder that if you are around someone with COVID-19 and you may have been exposed, it's a good idea to discuss right away with your transplant team so that they can make sure that you have the right recommendations for how to quarantine or get tested after your exposure. We still want you to stay home and tell your care team immediately if you have any symptoms of COVID-19. And I would recommend that you avoid traveling to areas where there are rising numbers of COVID-19 cases. So like we discussed at the beginning of the talk, especially in areas where there's lower vaccination rates, or for example, in people who may not have gotten vaccinated yet, or children who may not be eligible for the vaccination yet, there is still COVID circulating in our communities. It's at a much lower level. I think we're in a good place, but it's good to be aware of what's going on in the areas you may be thinking about traveling to.
Thanks, Kathleen. I want to thank you for talking with me today about COVID-19 and helping with answer the questions that we've been getting from our patients in our community. If you're concerned and you have questions, please do not hesitate to call your team here at Penn Transplant. We're here for you. We feel like we've all been through a long period of time where our lives have been really disrupted to a tremendous degree, and we're getting so close to returning to normal. But we just have to wait a little bit longer, take a few precautions, and remember, vaccines really will help us stem the tide of COVID-19. So be sure that you get vaccinated and that you and your family members and your coworkers and your friends all get vaccinated. So please reach out with questions, and thanks very much for listening to us today.